So firstly, aging is a success story. So we need to remember that. Yeah, and New Zealand, like most other countries in the world, has actually seen a significant growth in the older people, and that's a reflection of our lifestyles improving, our healthcare improving, etc. So first of all, it's a success story. However, there is a wee bit of a downside in that most of our healthcare delivery is around older people. So around just over half of our total lifelong healthcare costs occur in the last 3 years of life. And given that our older population is increasing so significantly, it's beginning to actually show through the way we deliver hospital services and primary care. So like, for instance, general practice. So pressure is increasing, and we can see that if you go to ED today, if you go to one of the medical wards, you'll see most of the people in those wards and ED are over the age of 65, and that's what we're seeing. So the pressures are beginning to rise. So if you look at some of the traditionally very old countries, so for instance Italy, Japan, the UK, where they've seen that big growth in the numbers of older people 10, 20 years ago, you can see the pressure points it's had. For instance, the NHS, you see very regularly how it's failing, how there's too much pressure. You're waiting for months and months and months to see just an appointment for your GP. So we need to learn from that, and we need to say, well, this is not a journey we want to follow. We want to do things differently. We want to see where they failed and actually pick up and identify ways and solutions to stop that happening. And we're beginning to see that, and we're beginning to do that. Without any doubt at all, it has to be a digital solution. So, for instance, if you look at the numbers available healthcare workers, that is decreasing as well. So for instance, from now to 2050, we'll move from around about 14% of the population is over the age of 65 to 2050, where it's a quarter. So over a quarter of the population will be over the age of 65. So that's 1 in 4 people will be over the age of 65. That then has an impact on the number of people who are able to work and who are able to deliver healthcare. So if you've got increasing demands on one side, but less people able to give that healthcare needs and meet those healthcare needs of this growing older population, we need to do something different. And the only thing we can do is to actually provide digital solutions to it. And that's why it's so critical. If you look at, for instance, the UK, they haven't gone down that road, which gives us the opportunity to invest now, find the solutions, and then when we do reach that tipping point where we have less people to deliver health services but more demands, we're in a good position to actually deliver high quality services.